So this part of the story took us to Salem, Missouri in Dent County. You head out I-44 to Rolla and then head south. It's a town of about 5,000. It has a great old 1870 courthouse, a historic downtown, a more modern business strip, and it also has people without health insurance. Dr. Vicki Gully sees those patients in Salem and in the free clinic she runs in Newburgh, Missouri.
Certainly, the rural areas have maybe even more reason to have less coverage. Small companies that can't provide health coverage, and there's no insurance available. Walmart in a rural area becomes a big employer, and they tend to do a lot of part-time, so they don't provide health coverage. People that have their own businesses, they're out there cutting wood, or they're out there, small farmers. They cannot afford, there is no way to afford their premiums monthly buying some health insurance off the internet. It's not possible. They just risk it.
The numbers vary throughout the state, but the highest percentages of uninsured, 20 to 25%, are in rural counties. In St. Charles County, only 9% of the population doesn't have any kind of health coverage, 12% in St. Louis County. In St. Louis City, it's around 19% uninsured, and that's about the same as Dent County. Of course, here, the actual numbers are a lot smaller, but the problems are not. Still, Salem is luckier than some towns. It has a hospital, the only one for miles around.
His doctor and my doctor are both here. My husband has been flown out of here 3 times for heart trouble. St. Louis.
You're lucky to have this.
Yes, it is. We are very lucky to have it.
We're a 25-bed critical access hospital, and we also have 18 long-term care beds, which is nursing home beds. We have our own home health agency. We have our own ambulance service. We have our own dialysis unit.
This is Salem Memorial District Hospital Administrator Dennis Pryor.
For health care, we're well contained here in the Salem community.
I mean, this is, you know, again, in a metropolitan area, there's lots of hospitals competing with each other, right? You're really playing a role that this community is dependent on.
Sure. We have a lot, we're an economic factor for our community, but also for healthcare wise, patients travel up to 50, 60 miles to get their health care here in our community. So, we're a very vital part of our community. If the hospital wasn't here, they'd have to drive that extra 60, 70 miles one way to get to Rolla or Houston or some other hospital.
Oh, it's great. It can save your life in an emergency to get you somewhere where they can cure you.
They don't deliver babies anymore because of the cost of malpractice insurance, but they have expanded the space and the staffing of the emergency room. And here in Salem, just like at St. Louis's big hospitals, they can't turn people away. So this is quite a bit larger than it used to be.
Oh yes, a lot larger.
This is one of the key parts of this debate, the fact that the emergency room is a place anybody and everybody can go, and they will get treatment.
Yes. No discrimination whatsoever. As a matter of fact, we can't even ask if you have insurance or your private pay until you've been triaged in that room right there first. Then you go back out. But first we have to triage you to see what's going on with you.
So this is where right now, hospitals get some federal money to help pay the costs of treating people who can't pay. These are called disproportionate share hospital or simply DSH payments. But under the Affordable Care Act, that money is going to be shifted to Medicaid expansion. And while states can turn down Medicaid expansion, it doesn't mean they'll keep the DSH money. St. Louis University health law professor Sidney Watson, a supporter of the CARE Act, co-authored a study that says the decision on Medicaid expansion will have the greatest impact on rural Missouri.
There is no contingency in the law if Missouri doesn't expand Medicaid. Our hospitals will be caught between a hard place and a rock. Many of them will see reductions of 40 to 50% in their DSH payments. We will lose rural hospitals.
My hospital here would be about $1 million loss.
A year.
Which could be tremendous, yes.
What does it mean?
It means the hospital might not be here anymore.
Really? I mean, is it something that you worry about?
Yes.
But will that really happen? Nobody wants hospitals to close down. Would the proponents of the Affordable Care Act let it get to that? Are the opponents willing to take the risk? Here's the answer: maybe maybe not.
Maybe if you rework the proposition, we'll expand it in another day. But clearly, while we're waiting to see what changes are made, for you to continue to fund the charitable care that's provided by our hospitals, it makes complete sense from a human perspective and also from a financial perspective.
We're going to have flexibility on it. I'm opposed to just an outright expansion.
But you don't have the flexibility at this point, do you?
Not yet.
It's going to be interesting to see what different states do. And the question where the ideology wins out and there's a chance to kind of maybe force some changes in Washington, or the pragmatism comes out and said, this is the law of the land. Let's move on. Let's implement this as we go forward. But we're already starting to see some of those states peel off. And so the question is, can Missouri afford to be an island? I don't think so.